Hi, so my name is Natalie Jones, and I'm here to talk to you about my career in health. And it is really kind of all over the place, to be honest. But it all stems from two of my favorite things, which is being active and traveling. And so growing up, ever since I was little, I've always been super active and involved in a multitude of sports. So soccer, t-ball, swimming, track, cross country, gymnastics. I did a little bit of everything. I ended up sticking with soccer though, and I played soccer in high school and I also played soccer in college. So this is where I truly ended up loving the team atmosphere. I'm a social butterfly, so I love hanging out with my friends and I love just having fun and being active with people for the most part. So I was really interested in teams and in figuring out how the body works when it comes to sports and being active. So I ended up studying, my major in college was exercise science or kinesiology, so understanding how the body works and moves. And then I had a minor in psychology because I thought I wanted to work with the dream, work with professional athletes and helping them coach with mindset and movement. So that's what I thought I wanted to do. And then it all changed. My senior year, I actually took a class called Health, Healing, and Culture. And it was all about how one's health is influenced by where they live, the people that they see, and the culture that they are involved in. And I had never thought about health that way. And so, of course, this is my senior year, my last year in college, and I get this amazing opportunity to then travel with one of my professors abroad. And we really look into health and culture. So I got to do that my senior year as well. And that just changed everything. So I decided to go back to school or to continue my education and get a master's in public health with a focus on health behavior. So I was really studying why people make the choices that they make. Was it the different surroundings? Is it just the different policies even, or the environment that's influencing their behavior? So sometimes it's not as easy to be active or to make nutritious food choices because those options may not be available for people. So that's what I studied during my master's. So I ended up graduating and going to Zimbabwe, and I got my global health certificate. So Zimbabwe in Africa. And I got my global health certificate for working at Africa University with the students there on campus with their health clinic. So this was another eye-opener of just seeing how different environment, different social settings, but all people have different behaviors and different health choices, and really studying and looking at the impact of what that looks like. So from there, when I came back to the States, I ended up getting a job with UK Cooperative Extension, and I currently am the family health specialist for family and consumer sciences. So my job is looking at the entire state of Kentucky, and I am focused on the health and well-being of all Kentuckians. My main job is supporting our agents. So we have people who we call agents in every county, so 120 counties in Kentucky. So where you live in Kentucky, there's an FCS agent. And so my job is to support those agents, those people, in delivering education regarding health behavior, whether that is, like we said, getting more physical activity, getting more movement in through the day, or if it's making healthy food choices. So that's my job, is designing these evidence-based programs, which means that they are research-based and that we have tested them with pilots, with different cohorts. So we've gone through and done analysis on these programs, and we know that they are successful. So one of our programs is run through the CDC, and it's called the Diabetes Prevention Program. So it's all about lifestyle change and how we can increase movement and physical activity. So while I hold this position at UK as our family health specialist for Cooperative Extension, I am also working on my doctorate in public health because I even came to the conclusion with working with UK that throughout the state of Kentucky, we have different counties that have different opportunities and different environments that influence our health. Again, a common theme, but one of the things that I now focus on with my doctorate in public health is health management and policy, a big emphasis on policy. So what I have seen is how policy and environmental change can really influence people's health. So my current research, what I'm focusing on, is really how to increase movement and physical activity by focusing on connectivity. So that means sidewalks, that means trails, that means different roads, and how that network of systems of trails can influence one's behavior. And if people feel safe to go out and walk, if there's lighting, if there's sidewalks, then people will be more active. And so that's what I focus on now, currently with my studies, with my doctorate, is on how we can make these policies and environmental changes that really encourage people to be active and make sure that everyone has the same opportunity to be active and move their bodies. So thank you for watching and for learning a little bit more about public health and focusing on the built environment and how there are so many different influences on our health, whether it's our culture, our friends, our families, our environment. Everything influences our choices. And if you have any questions, do not hesitate to reach out. I am happy to talk to you about my journey through public health.